Yeah.
I I felt good about everything.
Yeah. I cannot give credit to my class. I think it's also your shift of mentality that it did it, because it's like this, and that's human nature, right? Some of us can learn from other people's mistakes, and others will be like, yeah, I can do it, and they kind of like do it lightly. I think that
Hmm.
was the content is definitely helpful. I mean, I take nothing away from that, but I think you also worked hard this time, didn't you?
Yeah, I did. I did all the things that you told me. And I'm really glad that I had messaged you. I think it was last week or maybe the week
Yeah.
before, and you said take the crash course like one more time and then schedule. So I did reschedule my exam. I think I was supposed to test Friday last week, but you recommended going through the crash course again. So I tested today, and I think that that was a really good idea. And I appreciate you making that recommendation to me.
Yeah, no, I mean, I don't have a crystal ball, but I have done this over 4,000 times, right? Each one of the students that have gone through the course, it's like my own brother or sister.
Hmm.
I really, I take it very heavily when somebody doesn't pass. That's probably the only thing that gives me up, because it is painful, and you have experienced that, unfortunately.
Yeah,
But I
yeah.
am so glad that you passed this time. But what have you done differently this time? I mean, what was your steps?
The first go around, I didn't. I think the biggest thing that I did differently was time management,
Hmm.
because the first time I was trying to rush to get it done before Christmas, and just I didn't really study well. I didn't really designate the time. And I think that that probably is my biggest difference. And then the second thing um, is really understanding what the content meant. I mean, you go through school and you learn and you do the papers and you go to your clinicals or whatever, but the application, just really learning what things meant and why I'm looking for the things I'm looking for with patients and whatnot, um, was something that your class really brought out of me, I guess you could say. And so I think it was that. Like, if you asked me right now, I just took my test a couple hours ago. If you asked me like any one specific thing, I don't even know if I can remember anything. I had a lot of anxiety. Like, I had to take propranolol before I took the test.
Yeah, well, that's okay. But let me ask you a question though, so I have a little bit of awareness. Did you complete your 4 diagnostic tests?
Yes.
Okay. Did you complete the crash course review question bank? Do you have time for that?
Yes, I did all of the 600 questions, and I did the four the four diagnostic tests, I guess it
Yes.
was, and I really scored anywhere. One of them I only got like a 76, and I was really
Hmm.
disappointed in myself. But otherwise, I got in the 80s and the 90s with all the other
Okay.
ones, and so I felt like my average was probably pretty good, but I didn't feel 1000% like when I walked in there today that I was going to pass. I had a strong suspicion that I had the knowledge, but I didn't want to let my guard down.
Yeah, I mean, one thing is being overconfident to be like, yeah,
Hmm.
and I don't think no one ever gets that to that point. I mean, there's a lot of information, there's a lot of things to trick you guys, but
Hmm.
I really think that I tried every possible way with PDFs, with question banks, with
Hmm.
Kahoot, with
Hmm.
live classes, with the video classes, and
Hmm.
always hopping on to different things and different flavors to see if it gets everyone on a
Hmm.
100% passing rate. So,
Hmm.
it is a painful experience when somebody doesn't pass, and I don't
Yeah.
wish that on anybody. I mean, that is crushing the soul. That's what I would say. It's
Hmm.
Well, congratulations. That is absolutely
Thank you so
awesome.
much. Thank you
Yeah.
so much. And good
Yeah.
luck to everybody.
Amy,
Uh,
kindly send me an email so I can also send you the link if you feel that it was helpful. You can drop a review that really help us.
oh,
You
sure.
know, we've been
Hmm.
struggling because we lost all our reviews in the past 3 months, and a lot of people been coming forward and helping us out there, and it's amazing. So
Yeah,
um,
absolutely. 100%. I'll
before you
do that.
go, let me see if
Uh-huh.
anyone has any question for Kelly. If you
Okay.
can,
Oh, hi, I'm
oh,
Sarah. I actually have a
Kelly or
question.
Sarah, either one. So.
Hi. My name is Sarah. I'm going to be testing soon, but I was just curious for both of you, when you practice the diagnostics, how many times you take the practice test for it before you felt ready? Did you just do it once or did you do it like
I
twice?
just did. So when I initially joined the program, I took that very first test where it says like start here to kind of, I guess, assess like where your knowledge base is. And I did terrible on it, like in the 60s. And
Sure.
so then I just started going through the modules and attending the live classes and the crash course. And then I went back and did all the 600 questions. So the 6 different sets of questions once, except the first one. I did retake it because I was like, I did really bad on this. And I got like a 93% when I retook it just the other day. And then I did the 4 diagnostics. So I only did the test one time. Um, yeah, I only did them except the very first test I did twice.
Yeah. I mean, I just want to kind of like give a little heads up on this, right? Because, for example, we had one person, and not saying a name, the one person that did not pass, right? But she completely ignored the whole class and question bank and everything else, and took each of the diagnostic tests, I think in total 40 times.
Oh my goodness.
So what I'm trying to say to you guys is that the person maybe I'm I'm assuming this, right, is relying just because the crash course review, I mean the diagnostic tests, they are good, but a word can change the whole answer. So kind of what I'm trying to say is don't memorize it, understanding. Just because it is high yield, you should not ignore everything else because it's the whole package that makes it better.
I think that what I would just tag on to that is there were a few questions today that I kind of laughed because I was like, oh, I've seen this question, a very similar question. But there was a lot of things that I had never seen and a lot of really critical thinking that for me today. So I would 100% agree that just passing your tests or memorizing them would not be the best practice to be
Right.
successful.
And specifically, like when you take our test the first time, is that's the only time that counts. Because after that, it is impossible for me to give you a good recommendation, whether, you know, I think you're good or not,
Mhm.
because I can't, there is no way for me to know if you memorized it or you actually learned the content. So it's kind of, so every time you guys get ready to take the diagnostic test, make sure you have review your material. It's like the board. It's very similar in many ways, right? It is stressful and you prepare each time. So that gives you 4 chances to almost take the board in an environment that it is somewhat similar and stressful. But that really will lead to success in many ways as well. So alrighty, so lots of good news, lots of folks passing. That is always a wonderful thing. So thank you, Kelly, and thank you, Amy. Please send me an email so we can make sure that you're, if you feel like you want to do the psychopharmacology course, that's fine. But I really appreciate you guys, that it's what it is all about, right? Yesterday, I think we stay up to midnight answering questions just to make sure that everybody knows where the content is and how to get the best resources and make this course the best possible uh, for your situation, right? RM, do you have a question there? No?
Hi,
You're
I'm sorry, Dr. Lopez. I just
hi.
wanted to jump on and tell you that I passed yesterday, and I wanted to
Oh,
thank you so much.
nice, nice. Well, I only see RM. What is your name though?
It's Renee Mertz.
Renee.
Yeah.
Okay, Renee. We've been talking emails every now and then. So
Yes, right.
that is awesome. Do you have a hard time, or it was kind of like, I got this?
I got this. Mm-hmm.
Really? Yeah, because I
Yeah.
remember your test scores, and I said, there is nothing to worry about here. It's you're doing wonderful. So,
Well,
oh,
I followed all of your advice, and that's what I would recommend everybody do. Follow his advice, and I improved on every diagnostic test, and I mean, I was really confident when I was there. I was like, okay, I know this,
Oh,
I know
you need
that,
people
I know
have to come pick up.
this.
I'll let them know. Okay. Thank you. Bye.
that is nice. That is absolutely nice.
So thank
Um,
you so much. I had
did,
a rough start, but I definitely am happy that I got on board. I started in December, but unfortunately, about 2 days after I started, my dad ended up with brain cancer, and it turned out he had glio.
oh
So that
no!
wasn't
Oh my
great, and it
God!
put me behind by a good 4 or 5 weeks. But I kept saying, this is the most important test of my life because I was
There
listening
you
to
go.
you, and I got on track. And now I'm going to celebrate his birthday this weekend, and I'm going to bring him my letter of passing. So
Oh my, I mean, that gives me chills. I mean, it really does give me chills because it is a happy moment, right? I would say to me, other than my wedding and my daughter's birth, I think that
Mhm.
was probably the most significant change in my life, and that's what I wish for everyone to achieve. I mean, it's different for everyone, right? I mean, to me, this was really important, really, really important. So
Right. To
I
me
wanted
too.
to, well, congratulations, Renee. That's awesome. Make sure you send me an email kindly, please.
Okay, well, thank you, thank you, thank you. I don't know how to thank you enough, and I will recommend you to everybody I know who's looking or asking.
Awesome. So we'll be getting started in a second. Okay, you have a quick question there. I don't know if it's for me or for one of the folks that passed, or you are muted if you're trying to speak.
Good evening, Dr. Lopez.
Hi.
Although, yeah, I just joined the class newly. Although I'm still in
Okay.
school, I will be done in April. But I just want
Okay.
to get prepared because I'm planning to write in April. But I
Okay.
did the first pre-test, although I scored 68.
That's
So,
great.
but I'm still
That's
trying
good.
to work. Yeah,
Yeah.
I'm just
No
following
worries.
your.
Okay, no worries. At the end of the class today, we'll do a little orientation, make sure you know where the PDFs, question banks, and things like that. Guys, the first test is hard, right? Because you're just coming in and you don't know where things are, and you may not have seen some of this content. Some of this content is very tricky. Laws in psychiatry, no one studies that. It's something that are very broad, and sometimes we don't cover in school. So it's very important. So don't worry about it. What I say to everyone is, when you take your first test, don't look at the answer, because if you look at the answers at the end of the course, you might remember those answers, and that is not a valid predictor. The whole idea is that you take the first diagnostic test and don't look at the answer. Just memorize 60, 68. 68 is a good score. Now, one thing is, like, we had someone that scored really high on the first time, and she wanted to test in 10 days. I said, you know what? Go ahead. Do the crash course review, do the question bank, and the diagnostic test, and test in 10 days. I mean, not everyone will score high, right? So if someone does, we can make a little change to make it more straightforward to where you need to achieve your goals. So, all right. So awesome. Thank you and welcome. If anyone is new, we'll go ahead and do a little orientation at the end. Glades, the last person, because we got to get started. You have a quick question there, Glades?
Yeah, Dr. Lopez, I just have one question. There was a question on the test bank that I know during the crash course you said we should give Benztropine for patients that have is it Akathisia? but I was doing the test bank and the question, I failed it because it says it has to be propranolol. So I wanted to
Okay.
clarify that.
So we'll clarify that at the end of today's event, but you need to
Okay.
go back. You need to go back to that question and find that question.
Okay, I'll do that.
Okay, because it's
Yes,
very
sir.
important. So there is one instance in which propranolol is a better answer than cogentin. Anybody remembers what is the psychiatric condition in which propranolol is better than cogentin? If you akathisia. Okay, so what is akathisia? It is a pacing back and forth, and for that one specific answer, propranolol is better. Other than that, tardive dyskinesia, we do not give cogentin. Other than those two, you're pretty much safe, right? So good, good, good. We'll go back and then we can review that. If you can find the question. When people ask me questions, it's always helpful if we have the whole question so we can analyze it and don't necessarily dismiss anyone, right? So,
Okay. Because I
right?
know when
So,
I was studying, it said propranolol, but I remember
okay,
that during the crash course, I wrote it down. You said Benztropine, but I wasn't
okay.
able to stay back to clarify. So thank you for clarifying.
All right, no problem. So, last thing before we get started, it'll be real quick. Yesterday we were talking about a condition in which sick cell patient might be hydration or might be some psychological conditions. So I created the question yesterday, and for that one, I actually chose the question to fit what could be a good answer. But most importantly, you guys, I don't know what's going to be on the test, right? Like, I have a good idea. I have a very, very, very good idea. But if you take it everything, if you're trying to rush through it and not understand the content, that could be a bad idea. All right. So again, we'll get started. Patricia, you unfortunately have to get started, otherwise we won't be able to cover the things that we want to cover for today's. Today's not a long day, right? So, but we want to make sure that we cover everything. So please hold off the question. You can have your hand raised, so you'll be the first one to ask questions once the event is done. Okay. So today is module 5. If you're new and starting today, do not worry about that. The live class is a way to allow you to go through the same content twice, one time on your own. You have to complete. I would suggest that you complete the module on your own and still come to the live class, right? So when you complete the module, you should immediately do the question bank. Do not jump into the next module. Just to say, oh, I completed, but you're not able to retain the information is not a good way to prepare for the board. This is a hard test, okay? But I also tell you this, though. We are arming you to make it almost impossible for you not to pass. We're not rushing you. We allow you to come as many times as you want. We're not saying, oh, you attended the module 5 once, you cannot come again, right? We don't do that. We don't charge you monthly either, right? We'll give you, email me. We'll give you support as long as you are with me. And quite honestly, we try to make everyone's situation, to understand everyone's situation. So, but it's very important that you also have a timeline when you want to accomplish your goals, because otherwise you might be pushing the test longer and longer and longer, and that is not helpful to you. And that is the least thing I want to be not helpful to you. So, ethical principles and cultural questions. If we look
Dr.
at,
Lopez,
yes, my dear.
sorry, please. I was cut off. I didn't hear what you were about to say concerning.
Okay. I'll go ahead and repeat everything at the end. I just gotta finish this right now, okay, my dear? So give me a second, please. Otherwise, I
Okay.
won't be able to do the class. All
Okay.
right, so sorry about that. So if we look at the, okay, I'm gonna make one exception here. Lana, did you take the test or you have a quick question?
I just wanted to ask something in the end, so I just
Oh, okay, no problem, no, gotcha. Because I know you probably had your test.
I schedule for next week.
Yeah, okay, gotcha. Thank you.
Yeah.
I just I don't want to keep you if you had something very important to mention. So everybody else, as always, I will stay back for an hour or two to answer any questions that you have. Okay, so right now we're trying to get through this content. Otherwise, the people that needs to go, they'll be here with us longer. So about 29 questions will be from module 9. Modules 1, 2, and 3, there will be 107 questions. So what does it mean to you? Well, therapy is only 17, and therapy is the hardest module. So when you tell me I don't feel good about therapy, I say, yeah, that's good. That means you feel good about everything else, right? I hope. So spend your time, be careful on modules 1, 2, and 3. Understand everything on the PDF. There is almost no fillers whatsoever. Everything that is covered, there is a reason why. Everything is pretty much, we think through as much as possible, and we're always making changes to always make it better, better, and better every single day. If you look at the question bank, questions are added 10 questions a day, sometimes 100 questions at the end of the month. So that way it fits your situation, you know. And when you're in doubt, if you're in a good position, it is easy to answer. Ask yourself, what was your score on the diagnostic test? And I always say you have to take the 4 of them to make sure it's valid, right? It wasn't a fluke or a bad day. All right. So that being said, let's start today's culture, ethics, and legal principle. It's a very important module. 1, because it's not that long. And 2, because it's 29 questions and we want to get each one of them. Okay. So yesterday we covered the first part. I just want to give a quick 5 minutes talk on this. Scope of practice, the state defines what you can and cannot do. Each state is different. So the state relies on the board of nursing to write what you can and cannot do. The standard equals to quality of care. And who's responsible for the quality of care developing the standard? ANA. The why is important to judge you, to be able to take someone to court and ask the question, did you follow the standard of care? And when they do that, they can never compare you against a social worker, a psychologist. They have to compare you against one of your peers, right? Now, confidentiality. There are many instances that we can break confidentiality, but confidentiality is one of the 3 patients' rights. Right to confidentiality, right to least restrictive environment, right? And what is the last one? Anybody remembers in the chat there?
Informed consent.
Informed consent. So these are patients' rights, right? Privacy is nice to have, but it's not always applicable. For example, let's say you get a call and it's your day to cover the inpatient ward or inpatient unit. You get there, Nurse Susan says, hey, we have a new admission. His name is Mike. I don't know why I'm saying Mike. Yesterday I picked Mike again. And Mike is pretty violent. And he's, I wouldn't be there alone with him. So what do? You interview Mike in a cafeteria? No. Do you interview Mike in a closed door to allow for his privacy? No. You interview Mike in a in an environment that is quiet, but the door is open so that you can escape and Mike can escape from you, right? Now, what are the instances that we can break confidentiality, right? When there is a imminent danger to self or others, that's number one. When the court says you have to break confidentiality, when the lawyers involved in the case, they need the paperwork in order to to provide the case. When insurance requests for it, you have to break confidentiality there, because otherwise how would they pay for it? Now, insurance can be Medicaid, Medicare, or private insurance. They need the documentation in order to um pay for the bill, right? So they need that. And lastly, when there is child and elderly abuse. Now let's connect that to the state or the scope of practice. Again, yesterday I think we spent about half an hour on that topic, but I want to make it even more clear today. The Tarasoff principle, right? And the scope of practice. What is a Tarasoff principle? Equals to duty to warn, right? However, the scope of practice dictates what you can and cannot do. Now, the Tarasoff principle is not applicable in every state. So what is the answer, Dr. Lopez? Two possible answers, primarily, and there is an exception: calling the police or calling the State Board of Nursing. But why? Because each state dictates what you can and cannot do, and the Tarasoff principle is not applicable to all 50 states. And guess what? You are taking a national board that needs to be applicable to everyone that's taking the board. Now, the exception would be when someone is saying, I think someone poisoned my food at the nursing home, and tonight I'm going there and I'm going to put fire in the nursing home, right? In that case, you let the manager know, hey, we have a possible homicide attempt tonight, and then you call the police, right? Now, we went into lots of court cases that will be very important, and we'll go back to that at the end of the course, so at the end of today's event. Informed consent. In order to be consent, one needs to understand what they're consenting to. So the question becomes, can a dementia patient give consent? Depends. Can he or she state the risks, the benefits, the alternatives, right? Can they say it what they are consenting to? In order to be consent, it needs to be voluntarily, right? It needs to be, they need to be aware of what they're consenting to. And now we have 5 topics, well, 6 topics to cover today, which are the ethical principles. We're going to go over research, health policy, very complicated, right? Just culture, pretty easy, quality improvement, and patient-centered models, okay? And then after that, it's free. Any question that is in your mind, we can answer any questions from anywhere. Now, if you are going to ask a question, it's always best to have the whole question so that way we're not misleading or not making assumptions, okay? But if you don't have the whole question, I'll do my best to answer anyways. All right, ethical principle. I can tell you right now, out of those 29 questions that will come from module 5, I'm going to guess about 4 to 6 questions will come from ethical principle. Now, there are not many of them, but it's important that you fully understand. Here's the thing about the board. Any easy content, like the ethical principles, they will find a way to make it hard questions. Okay, so for example, justice is doing what is right. Okay, in terms of a fairness, aspect of care, regardless of color, race, religion, and, and financial condition. How will the board treat you? For example, if a surgeon is doing a, let's say, if a surgeon is presenting a research and during the research, he excludes some people of the information, there would be a break in justice. Now, let's say that I have, I don't know, I don't have a medication in front of me. Let's say I have a medication X, and medication X costs $1,000. Now, my patient John could benefit from the medication X, but I would say, you know what? John doesn't have money. I'm not even going to offer it to John. There would be a break in justice, because what would be fair would be to offer the medication X to everyone. Now, John doesn't have money. I can look at the pharmaceutical company and say, hey, no, John would benefit from this medication. Is there any resources available or financial aid that we could still allow him to take this medication, right? But I cannot exclude John right away because I think he doesn't have money. Justice is a very high yield topic, and you will see justice on the board. There is no other way around it. Okay? We'll do lots of questions, and we make sure that from now on, any of the ethical principles, we know how to apply it. Because what the board will not do, guarantee you this, they will not say, which of the following definitions best describe justice? That is too simple. That is for high schoolers. Even middle schoolers can memorize it. The board is all about application. Non-maleficence, doing no harm. Easy, right? Well, it is. How would the question be? Simple as that. When you are withholding a medication from a patient because that medication could cause some side effects. Okay, so let's give an example. Let's say your patient previously benefited from trazodone. He had the most wonderful night of sleep. Great, until he had priapism, which is a male's erection when it is not appropriate to have an erection, right? It is painful and it is a medical emergency. And it is one, I want to say 1 in 10,000 cases, or very close, I believe it's 1 in 10,000, that this could happen for those taking trazodone. It is not a side effect, it is an adverse effect. Knowing that John, or whatever male you want to call it, had priapism, you say, I understand that the medication worked for you. However, I cannot prescribe you the medication. And what ethical principle are you using? Non-maleficence. Is it only about trazodone? No, absolutely not. Questions about benzodiazepine, Xanax, right? If someone had abused of the stimulants or benzodiazepine in the past, they may have a tendency to abuse those class 2 medications, class 3, class 4 medications, right? So you have to be careful and use your best judgment in order to practice non-maleficence, okay? So non-maleficence is very common with trazodone, benzodiazepine, stimulants, and many other drugs, really. All you need to remember is the application of it. Now, beneficence, on the other hand, is doing good. How? When you are prescribing a medication that fits the diagnosis. For example, when you are prescribing an SSRI to someone with major depressive, which ethical principle are you using? Beneficence. And this is exactly how the board will ask you the question. So justice, offering for everyone, everyone's equally entitled to the service or product. We are not saying that someone that does not have money will necessarily get it, but we have to make it sure if we are offering a service to the population, everyone should have opportunity to take care, to participate on the service. Non-maleficence is us withholding something that could cause harm. Beneficence, it is us doing good by prescribing the right medications to the right diagnosis. Fidelity, being faithful, loyal, it is fidelity. When nurses keep the promise, their promise, they are being faithful to the customer, i.e., the patient, right? It's about integrity, right? It's about honesty. So, for example, meeting the patient reasonable expectation is the role of fidelity. For example, when you are a competent provider, the ethical principle that you are utilizing is fidelity. You are being faithful to the promise of doing good. That is fidelity. Okay? Veracity, that is pretty easy. Telling the truth, not lying. Autonomy. Be careful. Board loves to mix autonomy, as in your autonomy to prescribe or do things within the scope of practice, and the patient's autonomy, the right of he or her to make decisions, right? Autonomy is high yield, self-determination, right? So, for example, when a psychiatric patient in the inpatient unit that was committed involuntarily says, you know what, maybe I was suicidal, today I'm good, I do not want to take that lithium, I do not want to take the olanzapine, I don't want it. Well, it's best for you, I do not want it. That is respecting the patient's autonomy. Now, which law case not only is autonomy, which law case covers the patient ability to refuse medication if they are over 18 years old? Anybody remember?
Renee and Kelly.
Yeah, Rennie versus Klein, right? Now, in the same scenario, Rogers versus O'Keen. Roger, let's say Roger is 17 years old and he says, I don't want to take medication. Mom and dad can say, you will take the medication. So what am I saying here? Minors have the right, minors can refuse medication, but the guardian can override it, right? So it's very close, two cases, right? So autonomy, always ensuring the patient have self-determination, right? And it's right here, actually, Rennie versus Klein cases, right? Respect is treat everyone with equal rights. And that almost sounds like justice, doesn't it? Right? So if we just cover 8 ethical principles, which one is not here? There are only 6. There are 7.
Respect.
Respect is not here. So we have autonomy, beneficence, fidelity, justice, non-maleficence, and veracity. The board will never ask you a straight question about anything. Well, not anything. I would think things like PICO, even that. It's all about application, okay? So don't just memorize and be like, I got it. Ask yourself, how could this be used on questions? And I'll tell you how. Okay. All right. So let's go on and just again Justice is being fair in all aspects. Non-maleficence is holding something back from the patient that could be harmful. Beneficence is doing good. Fidelity is being faithful, keeping promise. Autonomy is the patient's autonomy. Self-determination and respect is treating everyone with equal rights. Right, that is easy. Question. Anybody? Well, let me read it. If a patient with an anxiety disorder and a history of drug abuse requests Xanax, there are ethical principles to consider before denying the prescription. What is the ethical principle used to deny this patient access to Xanax? Beneficence, justice, non-maleficence, and or veracity, right?
No
Yeah.
maleficence.
Yes, this one is good. Now remember, this is probably the most high yield one, okay? In questions format, it never asks you is doing no harm, never. Okay, perfect. All right. When the PMHNP prescribes Zoloft to a patient with major depressive disorder, which ethical principle is most likely being utilized?
Beneficence.
Yes, beneficence. Okay. All right. Perfect. Okay. If a patient is excluded from treatment by a PMHNP for financial reasons, which ethical principle is violated in this situation?
Justice.
Okay. So I think we got this pretty good. There will be tons of questions in the question bank trying to make things a little bit harder. So make sure you guys really know them. And most important, when you learn something, you have to always revise it, right? Don't be the person that learns it, got it, and understood, and then you don't look at